I'm the Delivery Support Manager at NHS Improving Quality for End of Life Care, and I support implementers with the rollout of EPaCCs nationally. And Adam's on the call. Adam provides technical support for the programme, and Adam's based at the Health and Social Care Information Centre. And I think we're going to do this session today really as a double act, so Adam's going to chip in. And I think initially we thought we would just do the presentation and then get to answer some questions and hopefully have some interesting discussions after the presentation. So to start, thanks Bev, you've already gone through the learning outcomes for today. And I think really it's important to say that we were initially approached by Bev's team to deliver two sessions around the electronic palliative care coordination systems, and we thought we'd split that into the two sessions. So today we'll focus on the information standard itself and how that supports implementation of EPaCCs, and then our second session, which is coming up in a couple of weeks' time, is around how information sharing enables care coordination, and that will cover some of the technical aspects around information flows and interoperability. So as I said, I've already gone through the agenda and the learning outcomes. So really we're moving on to the purpose then of the information standard, and I think it's important to recognise that the standard actually aims to improve care coordination through enabling better communication of people's wishes, in enabling them to meet their preferences and choices for care at the end of life. The standard itself specifies the core content which needs to be held within an electronic system, and it was developed with a focus of electronic systems, but it can also be used for paper-based care coordination. And we have more evidence emerging recently around how the standard is helping to improve care coordination and is helping to support patient choice and choices for end-of-life care. And there's a quick link there really to some information in a report that Public Health England published last year through the Intelligence Network that has some real good case studies and really good snippets of information there and evidence about how we're improving that. So, the information standard, as I've said really, is about helping people that are approaching end-of-life care and enabling professionals who are involved in their care to secure access to the information which is up to date and has all the information needed really to be able to make the right decisions at the right time and help, primarily to keep patients in their own homes where that's their preferred choice, or to enable their choice of care. So a bit of background really into EPaCCs, and the EPaCCs programme really came out of the 2008 National Strategy for End-of-Life Care, and one of the recommendations within that was to develop locality registers which would help provide a way of enabling effective communication amongst professionals. And from the experience of the locality registers really grew the electronic palliative care coordination systems, which are now being implemented right across the country with some, I suppose, some more success in some areas than others. But actually what we know now is that most areas are having some success and have got systems that are working across the healthcare sector, not always with health and social care, although there are some really advanced sites that are now able to do that. But EPaCCs is being, used throughout the country really to enable care coordination. As I mentioned earlier, the information standard, which is the ISB 1580, which is for care coordination at end-of-life care, was identified to provide information about the core content which should be held in those records. It was developed really by the national team and from the Department of Health, and was actually agreed and published in March 2012. And since then we've made a few amendments, one in 2013, and again are currently going through a change application to the standard. So whilst the standard was initially approved and published, I think it's really important to recognise that, you know, there is a team working behind the standard that is working with sites who are implementing EPaCC system and working with professional bodies to make sure that the information standard remains fit for purpose. We have joint sponsors for the standard within NHS England and Public Health England, and I thought actually it might be worthwhile sharing this slide with you that just shows the overall programme governance. So as I said, we have sponsorship from NHS England and NHS Improving Quality, and from Public Health England. We have an information data set management group that sits to review the standard and review changes around implementation and provide support to implementers who are implementing the standard. And we also have a wide suite of resources really that are available to help support that. We have the Standardisation Committee for Care and Information, which is the body that replaced ISB last year, and we're, as I said earlier, currently submitting a change application to the standard through Sky. You'll see on this diagram as well, it shows you that as well as having the governance of the programme from a steering group perspective, we also have groups that work from a technical aspect. So Adam really hosts a technical and advisory support group. So any changes or any information that we want to get back, any feedback, we can actually go out to the technical and advisory support group to gather some feedback from them. We have the EPaCCs user group that consists of a lot of implementation across the country. Originally, some of them were our original pilot sites, but we've now brought other teams into that user group. We also have the Clinical and Professional Assurance Group, which has representation from 12 governing bodies that provide advice and support for the programme and for the standards. So I thought that really might be helpful for you to start and understand where the programme sits and all of the governance that's behind the programme. So this slide really is about what are those core data items. So we mentioned that earlier, that this is what we recommend as the core data items that should be included in any record, whether it's electronic or a paper-based system. So you can go through, and these two slides are actually showing the data items that are being updated and included within the current change application. So it contains all the basic information that you would expect, things about consent, and we have a specific consent, explicit consent programme for the EPaCCs to actually have somebody create a record, and also explicit consent for that information to be shared amongst health and social care professionals. The other information in there is the demographics, which I'm sure you'll recognise, and there are some other specific requirements in there as well. So it will cover things from diagnosis, cardiopulmonary resuscitation decisions, advanced decisions, lots of things that are in there that are really helpful and will help with care coordination and people to actually make decisions around care and treatment for patients with having access to that information. Some of the data items in there you can see are mandatory, and some of them are recommended. The other thing really we wanted to cover today was just to make people aware that there is currently the change application process going ahead. We've just been out to consultation about some of the changes, and we're about to submit our application to Sky in the next month, and we're hoping that will go to Sky Board in June. So if the change application is approved, then we will be working to to implement those changes between July and December of this year. And this slide really just is showing what some of those proposed changes are, and I'm sure some of you on the call today will have taken part in the consultation and have seen the documents, so will already have an understanding of that. But I think it's important to recognise that, as this slide is saying really, that the changes are in response to issues that have been raised by implementers, so that is people who are using the standard within their EPaCC system. It's also taking issues that have been raised through the governance arrangements, and also through things that are happening nationally, so around, you know, the Liverpool Care Pathway review, and that being phased out from July 2014, and also with the judicial ruling from the DNR-CPR ruling. So again, we're constantly looking at the standard and making changes to ensure, as I said, that it's actually fit for purpose. I mentioned earlier that we have some guidance documents that support the standard, so it's not a standalone thing. We have the specification around the standard, but we also have these guidance documents that have been produced, and they are the implementation guidance, the record-keeping guidance, and then there is a summary record-keeping guidance document as well. And all of these documents have been endorsed by a number of organisations, and you can see there are organisations from the Association of Palliative Medicine, the Director of Adult Social Services, Royal College of Nursing, the Royal College of GPs, Royal College of Physicians, College of Paramedics, College for Emergency Medicine, College of Occupational Therapists, the Chartered Society of Physiotherapists, and the British Geriatric Society. So the standard and the guidance documents really have support from all of those organisations. Now, this next slide really is just saying that at the point of where we started the programme of implementing and rolling out EPaCCs across the country, the national programme had a level of ambition that we would have cover, if you like, of EPaCCs across the country, so that we would have reached 70% rollout of EPaCCs by 2015. And at the time, I think that was thought to be quite an ambitious level of ambition. And actually, over the last 2 years particularly, if you think about a lot of the changes that's happened within the health service, within the structure, the movement of organisations, then actually it's been quite challenging to achieve that level of ambition. But I just thought we'd share with you where we are now and, you know, what information we have around spread and adoption. So this slide shows you that originally in 2009, when the programme initially started, we had 8 pilot sites across the country that you know, were the main forerunners really of implementing an electronic system. And those sites do remain really our primary contacts and are the people who still have probably the most advanced systems at the moment. By 2012, we had some spread and adoption, so we had some sites interested and were working on implementation. We had other sites who were starting to put their plans together to roll out EPaCCs. But you can see within that short space of time there was quite rapid spread. And then in 2013, Public Health England and the National Intelligence Network did a survey of CCGs across the country to find out really what that current position was around spread and adoption, and just to really try and get some additional intelligence around what systems were being used. And I'm sure we've provided the links to this document, but actually some of the information that it was showing is that at that time, and again remember this is information that was taken in August 2013, it was actually showing that 64 CCGs had fully operational EPaCCs systems, and the definition of an operational system is where there is an electronic system linking care providers right across the locality. We identified another 106 CCGs where planning had started and they had clear dates for implementation, and those dates were between 2014 and 2015. So we knew that CCGs were well ahead and were starting to implement a system. This next slide just shows you really about some of the different systems that are being used right around the country, and I'm sure you know there are lots of different systems out there. I think one of the things that this report actually helped do was really dispel some of the myths that a lot of people thought an EPaCC was actually a system on its own, a standalone system, and actually what it is just about having the information standard and those core data items used within it to ensure we have consistency of information that are being used in any system for care coordination. In the last sort of 6 months, we've been trying to update those figures and find out really where organisations and CCGs are within their implementation, and whether those 106 that said they had planned dates for rollout of a system, whether they'd actually progressed. So what we've been doing over the last few months is pulling together some piece of information using what we had already from the CCG survey, using information from our local intelligence, so that was from the strategic clinical networks who were out there working with implementers and capturing information on progress and where they were up to. And also using our own database, which we had at NHS Improving Quality, where anybody who makes contact with us around EPaCCs or about the information standard, that we collect, gather some intelligence really from them. So we triangulated 3 pieces of information together there, and what our current assumption is this really, that we know that 43% of areas now have got a system that conforms with our definition of an EPaCCs system. 25% of organisations still have plans that are from early to well-developed plans for implementation, and that there is a 31% out there that we're not really sure what's happening, so we haven't got information around their plans for implementation, and that's something that our current work is now focusing around. So we're currently starting to contact those organisations to find out, if they do have any plans, what those plans are, and how we could help and support them. So we've mentioned some of the documents that are available to support implementation, and some of them are here, and we'll provide links for those for people, but I think most of them will have already seen them. But as a national team, we're still providing support for organisations, so anybody that contacts us, we can link them with other implementers, we can provide information for them that helps to support their plans. I think some of the key documents really that have helped people along the way are the Making a Case for Change document and the economic evaluation that was published in 2013, and they really have been documents that people have found really useful in supporting them. We are planning a further evaluation that will take place later this year, so we're just in the process of commissioning that, and the focus of that evaluation will be around patient outcomes. So we know, that teams, all the information we've been sharing so far is about people are rolling out EPaCCs. But actually what we want to know now is what difference is that making to patients and to carers. So that will be the focus of the future. We've just added in this slide, and Adam, I don't know if you want to join in here.
Yep.
Yeah, which is just to explain really some of the technical approaches around EPaCCs.
Yeah, so and I'll keep it fairly brief because I'll probably go into a bit more detail on the webinar in a couple of weeks' time on care coordination, information sharing. But broadly speaking, when we went around and spoke to the various areas who have implemented EPaCCs systems, generally speaking, pretty much the approaches fall into one of these 4 areas. I mean, it's obviously not exactly these 4, but these are the general kind of approaches people tend to use. So the first one being building on an existing shared clinical system. So this tends to be some of the big systems you'll be familiar with, like the GP systems, System 1 and EMIS, or an existing shared record system that's already being used by a number of services across a region, and it's generally fairly straightforward to create templates and add in new information, and that's what a lot of areas have done to capture the EPaCCs information set within those systems. Obviously, that's great for getting up to speed quite quickly for all of the people who've got access to those systems. The problem tends to come for the areas where the other services that don't typically have access to those systems. I mean, a good example would be things like ambulance services, out of hours, hospices, and things like that, where typically they will have a separate system. So there's generally other approaches that have to be used to get the data across in those cases. Another approach that's used in a number of areas, for example in London, the Coordinate My Care system, and across a lot of the southwest with the Adastra end-of-life care solution, is to have a dedicated system. So typically it's a web-based system. The advantage of which being that you can allow any clinician to log in across the whole region to view and update the information in that system. But obviously the disadvantage of that being that it's a separate system to their existing clinical systems. So therefore there's a certain amount of double keying again for that as well. Another approach which certainly early on a number of areas had tried to do, and with mixed success I would say, is using the summary care record as their EPaCCs. Now obviously, as you may know, you can within a GP system, by default the medications, allergies and adverse reactions flow up to the summary care record, but you can choose with the consent of the patient to include other information, including all of the EPaCCs information. So you can submit all of the EPaCCs information through to the summary care record today. The major drawback of that, as you may well know, is that it has to flow through the GP, who has to enter it and choose for it to flow up. So that tends to cause problems, especially towards the very end of life, when information can change quite rapidly, and people really need very timely information. If that has to flow through a GP to manually then choose to upload that information, that can cause issues. So for that reason, it's not sort of one of the main approaches people are primarily using for EPaCCs. The final one on this slide is portals. Now, I don't know if you're familiar with the concept of a portal, but it's not really an EPaCCs per se. It's really just a way of bringing together the information, the end-of-life care information, from various different systems to display in a single view, a single portal. So typically this will be part of a wider portal approach across a region, or it's certainly something that's used quite often in the acute setting to bring information together from various acute solutions and systems. So that again is, as I say, it doesn't really provide you the full EPaCCs coordination solution, but it gives you a view of the information at least. So again, it's something that's quite commonly used. So as I mentioned, some of the challenges around that: interoperability, which is a horrible word, but the electronic flowing of information between systems is a real challenge. But it's something that needs to be cracked to try and get over the whole issue of rekeying, double entry information, when you've got information duplicated across systems, keeping them in sync and so on. So it's been a key focus area from our perspective, working on national specifications and standards for that, which, as I say, I'll come on to in a bit more detail in a couple of weeks' time for those of you who join that session. Another key issue that comes up a lot is the question of consent, and I think it was touched on earlier. The whole model around having an explicit consent for the EPaCCs information can be challenging at times, especially if that EPaCCs information is within a wider record that's already shared. So there's some more guidance coming actually in the upcoming updates to the implementation guidance to try and address some of those challenges. And then the final one being reporting. And the information standard itself doesn't really cover some of the reporting aspects, but certainly one of the main pieces of feedback from a lot of places that have implemented systems is reporting is key, because unless you can start to see what kind of the impact of this is on outcomes and be able to benchmark whether the people who are on EPaCCs are achieving their preferences better than those that are not, then it's very difficult to then justify continued work on it. So reporting again is a key area that a lot of places are struggling with. So I think that was a very brief summary. I'll hand back to Chris.
Yeah. Thanks, Adam. And that's the end really of the presentation. So we hope we've covered what was in those original learning outcomes, so that we've given you an idea about what the information standard for end-of-life care is, how it supports care coordination, how teams are actually using that to develop their EPaCC system and to support their implementation of EPaCCs. A bit of information about the future, what we're doing with the current change application, and also about the future of support for implementers.